chapter 1, which is estrogen, behind the headlines. What is the essence of this chapter? What do we need to know about estrogen that the headlines are not covering today?
The main thing that is important for women to understand is one of the most singularly important studies on women's health, and particularly for menopausal women, was this so-called Women's Health Initiative, or the WHI. And this study was well-intended, and unfortunately, they got it all wrong. And I'll explain to you why just very simply. And the reason is as follows. In this study of thousands and thousands and thousands of women, instead of comparing women of the same ages, the women who got hormones in this study were in their 60s and 70s. And the women who got a placebo were in their 50s.
Wow.
And so what happened is when the study was done, they compared women in their 60s and 70s taking hormones with women who were in their 50s taking a placebo or a sugar pill. And they attributed the fact that the women who were taking the hormones had more problems exclusively to the fact that they were taking hormones. They did not factor in age as a variable, and not only age, but how many years they had been in menopause. And what we'll talk about, which will pop up repeatedly in different chapters, is the fact that when these same data, the same exact data were reanalyzed, the women in their 50s and 60s, there were still a few of them that were in their 50s that got the hormones. And when they compared the women who were in their 50s who got hormones to the women in their 50s that didn't, the problems went away. And as we'll talk about, depending on which organ system, whether we're talking about the brain or the breast or the bladder or so forth, what we're going to talk about is you'll see that in some instances, the women who received hormones actually had fewer complications, fewer risks than the women who took nothing. And so this has caused, as a result, over 80% of the women who were taking hormones to throw them away and stop taking them. And what that has done is two things. It has caused women for a generation to do without hormone therapy and suffer the symptoms of menopause without feeling they had a treatment option. And the second thing that it's done is because there were so many fewer women on hormones there are today than there were in 2002. There's 80% fewer women today taking hormones today than in 2002. And because of that, the doctors in training over the last almost 20 years have no patients to learn from and to have experience treating menopause. So we have a self-perpetuating cycle in which the doctors aren't comfortable, the patients aren't comfortable. You put two uncomfortable people together and they end up not getting treated optimally.
Exactly.
And that is a big issue for women, and the impact on women's health, on the quality of life, on the quality of their work, on the quality of their relationship has been immense, and it has been in a negative, had a negative impact.
And so you firmly believe that doing hormone therapy does not create negative consequences that outweigh the benefits of not doing hormone therapy.
Let me state it slightly differently.
Okay.
For the majority of women, that's true. There are always going to be some people who are poor candidates for any medication, and that includes hormone therapy. Maybe you already have breast cancer. Maybe you have a certain liver condition. Maybe you have a bleeding disorder, etc. There may be these circumstances. But overwhelmingly, if they started near the time of menopause, which I call the estrogen window, this critical window of opportunity, if they do that, then the benefits far outweigh the risk. And it's not just my opinion. This has now been proven over and over by looking at the exact same data, but analyzing it with a consistency of age instead of these two disparate groups.
You know, Dr. Mache, here's the challenge we face today. There is so much misinformation out there that once someone has formed an opinion, and I know this because I'm surrounded with people who've shared their opinions with me, including my own mom.
Right.
No, it's bad. and whatever information is coming out now is incorrect. How do we convince the women out there that are listening to us right now, and they have that niggling doubt,
Right.
that should I be believing this? What can you share to help them get over that hump of distrust that no, hormone therapy is going to kill me? Because that's literally what my mom said. Well, if I want to die early, sure, I'll take hormone therapy, but I want to live a long life, so I don't want to do hormone therapy.
Well, if you really want to live a long life, take the hormone therapy, because the study came out just in the last 6 months, showed that when they looked at the women who had taken hormone therapy, any kind of hormone therapy, even the ones that took it later with the problems, it's everything, the women who ever had hormone therapy lived longer than the women who never took hormone therapy if the women took hormone therapy for 10 years or longer. If they took it for 5 years, it was no difference. If they took it for 10 years or longer, it was about a 40%, there was a increment of a number of years difference. And if they took it for over 10 years, it was even a greater increment of living longer. But to answer your question, I realized that once something becomes emotional and becomes a fear, it's no longer an intelligence issue. It's an emotional issue. It's like some people don't like vanilla or strawberry, chocolate. You can't tell them that.
Yes.
You can't tell them it's good. But what I have learned from talking about this all around the country, on my book tour and other experiences, as I've spoken about hormone therapy all around the country, there's always a handful of women in every audience that are in their 70s or even older. And I ask them, why are you here? Because you're sort of past the window when people think about hormone therapy. Why are you here? And they will say always, I'm here because I had such a good experience taking hormone therapy. I wouldn't give it up when all that scare came out. And my daughter won't take it. And I want to make sure I'm not doing anything wrong by encouraging her to take it. So moms are still trying to help their daughters in their 50s. They're still trying to be the mother that cares and is getting information to give motherly advice. And the thing about it is that's so challenging. When you're about to go into puberty, moms have that talk.
Yes.
When you're about to get pregnant or have a baby, moms have that talk. But when you're about to go into menopause, moms don't have that talk. There's no connection between the older generation and the currently going through generation to convey that motherly wisdom. And in this last generation, the cycle has been completely upended because of the poor interpretation of a study that was designed with a flaw that ruined everything in terms of accurate information.
One more fear that comes up is cancer and hormones.
Right.
What information can you share? What research can you share to dispel the myth that hormones cause cancer? Or maybe it's not a myth. Can you shed a little more light on that?
So let me answer your question briefly, because I'm going to be talking about it more as we move through the various chapters. But in a nutshell, women are worried about breast cancer. I mean, let's face it. If you talk about what's the one thing that women worry about the most,
yes.
Everyone's got a pink ribbon and they're marching, and the different things. Well, the issue is this. For women who take, and this will come up in a few minutes when we talk about in the next chapter how to take estrogen and so forth, but some women who have a uterus have to take both estrogen and some type of progesterone because that protects the uterine lining. Women who don't have a uterus, who've had a hysterectomy, don't have to have progesterone. They only need to take estrogen. And this is a very big part of some of the other confusion. But the women who take estrogen and progesterone, the risk of breast cancer in that instance is about the same as the risk of being overweight, about the risk of having dense breasts naturally. So it's about 1 in 1,000. That's the risk with estrogen and progesterone. For women who don't have a uterus and who take estrogen only, this assumes they started in the estrogen window, close to the time of menopause, the risk of breast cancer is 23% lower than the women who take nothing.
Wow.
23% less risk of cancer of the breast if you take estrogen only than if you take placebo.
Got it.
So it's actually safer to take estrogen only, and only basically the same to take estrogen and progesterone, not really an increase or a decrease.